What are piles? Piles, also known as hemorrhoids, are swollen veins in the rectum and anus that can cause discomfort and pain. They are classified into two types: internal, which occur inside the rectum, and external, which develop around the anus. Common symptoms include rectal bleeding, itching, discomfort, and pain during bowel movements. Piles can be caused by straining during bowel movements, chronic constipation or diarrhea, obesity, pregnancy, and aging. Treatment options range from lifestyle modifications such as dietary changes and increased fiber intake to over-the-counter creams and ointments for symptom relief. Severe cases may require medical procedures like rubber band ligation, sclerotherapy, or surgical removal. Preventive measures include maintaining a high-fiber diet, staying hydrated, avoiding prolonged sitting or straining during bowel movements, and practicing good anal hygiene. Regular exercise can also help improve bowel function and reduce the risk of developing piles. It's essential to consult a healthcare professional for proper diagnosis and treatment, especially if symptoms persist or worsen. Overall, understanding the causes, symptoms, and treatment options for piles can help manage discomfort and promote better rectal health. For the best treatment of piles at Hamid Latif Hospital, Lahore, visit Prof.Zahid Mahmood. Call on 0300 413 0159 for appointment.